what our shitty ass healthcare has come to. Where my patients need medicine and supplies and their insurance won't cover it, and here I am spending my own money because my patient needs it, and he doesn't have any money and he can't work. And the insurance won't even cover what he needs. And I'm sad and I'm sick and tired of it.
The whole work requirement thing. First of all, most people who get their health insurance through Medicaid are working. I can think of many examples, but one that hits home for me is I had a conversation with the executive director of Minnesota's NAMI division. The people who are for this bill talk a lot about a young, able-bodied man sitting on a couch in the basement playing video games and I guess collecting Medicaid checks. First of all, people don't get Medicaid checks. You either get health care or you don't. And the way they're going to save $1 trillion is by not giving people the health care that they need. By definition, they are cutting Medicaid if they are counting $1 trillion of savings. But the NAMI executive director reminded me of, for example, young men with a recent severe mental illness diagnosis who is unable to work, I guess is able-bodied and that they are physically intact, but they are not able to work. So they need access to health care to stabilize their mental illness so that they then possibly can go on to work.
Exactly.
So the backwards reasoning around this is really misleading to the American people because it doesn't reflect what's actually happening on the ground.
I totally agree with that. I think there is a lot of fear mongering going on in order to get people on board. Bill has already passed now, but I think before that's what they were doing as well, was selling a false promise that this was going to be something good for the American people when in fact it is the complete opposite. And the irony is that a lot of our service members who come back from the military have complex psychological disorders such as complex PTSD, and they rely on Medicaid as well. Yeah. And Medicaid is not going to be covering behavioral health, and they're not going to be covering psychiatric and primary care. We are abandoning our Americans on multiple levels.
That's a great point. I think a lot of people don't realize that our veterans, many of our veterans do rely on Medicaid and SNAP for nutrition assistance. So we are just cutting people off at the knees. And for what? I keep coming back to for what? The whole reason we're talking about this is to pay for tax cuts for the wealthiest Americans. It's just, it's mind-boggling to me.
It is mind-boggling, especially when I learned that we're not even saving money.
Right.
We're adding $3.3 trillion to the national debt. We reallocated money to the Defense Department and for tax breaks, and we took it away from the poorest Americans.
It's the largest single transfer of wealth in the history of our country, from the poor to the richest. It's wild.
You do not get free health care. You do not get free health care. Do you think that people who are 28 years old that can work and refuse to work should get free health care?
Congressman, a lot's been talked about Medicaid, healthcare, etc. A lot of countries in the world, Europe, Canada, they have healthcare for the people there. Outside, just now you said, you don't want to see a lazy 28-year-old get healthcare, whatever. My point is, every working and retired American should be entitled to healthcare. Would you sign on or write up a bill for Medicare for all? We've got Medicare now. We can start rolling back the age 5, 10 years at a time. Would you support that?
We can't afford that.
Yes, you can.
Big, beautiful bill, Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
Here's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance. Because if you're not working, you're gonna lose your health insurance. And then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident. And for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that for you, for her. Now, thank God that she had successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house, you're going to lose your home, you're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're going to need it. For you, it's probably going to be a couple years, all right? Because I can tell you've probably been eating butter and fried chicken for the last 20 years.
Hey, Echo Room fam. Hope you guys are all doing well. You're all staying safe. Now, today's commentary comes from a series of videos stitched together by some seriously passionate folks on TikTok who are shining a bright, unflinching light on the American healthcare crisis. Huge shout out to the original posters and the stitches who made sure this conversation didn't just vanish into the void. Without voices like theirs, so many stories like this will stay buried under insurance paperwork and political talking point. So let's dive into the rest of the video and we'll be back for more commentary.
I don't know about you all, but I have gotten dozens of videos on my For You page of people talking about how their parents and their grandparents who are currently in long-term care facilities and are currently on Medicaid are getting these notices that they will be evicted from their facilities and they need to either pay up or find a place to live. And they're confused about why that is. And as a health economist who studies healthcare financing, I have a little bit of insight as to what's going on. A lot of it boils down to the One Big Beautiful Bill Act, which was passed in July, made these significant cuts to Medicaid. In fact, over $911 billion in cuts to Medicaid over the next 10 years. As I've said in numerous videos about Medicaid, Medicaid is a state-by-state run program. So each state is having to make decisions about what they're going to cut because the federal government has in turn cut their budgets about who they're able to cover and what they're able to provide in this Medicaid system. And for those of you that don't know, Medicaid is a huge provider of coverage for individuals in long-term care. In fact, 2/3 of residents of long-term care facilities are covered by Medicaid, and that's because of the financial differences of what Medicare versus Medicaid can cover, which I'm happy to get into in another video. In addition, this bill prohibits states from instilling new provider taxes, which would allow states themselves to raise money to support their Medicaid populations in light of the lack and the lessened support they are receiving from the federal government because of this bill. And so with these significant cuts to Medicaid, there's a lot of financial instability of these facilities, which largely accept Medicaid patients, to make decisions about how they are going to financially survive as an entity. In fact, a Senate finance report done recently in a cooperation with the Brown School of Public Health found that 573 facilities, long-term care facilities, were at the most risk of closing. And the biggest determinant of whether or not these facilities would close, in addition to occupancy rates and quality star ratings, is the percentage of residents who are currently covered under Medicaid. If you are a facility that covers a high proportion of Medicaid patients, your facility under the One Big Beautiful Bill Act is at the most risk of closing. So thinking about this from a business perspective, if you do not want your facility to close, you are going to have to make difficult decisions about what percentage of your folks are covered by Medicaid versus what percentage of your folks are paying out of pocket for long-term care. I would also be remiss if I didn't also mention that long-term care facilities, nursing homes have been bought up in recent years by private equity, upwards of around 5 to 15%, depending on the studies that you read. I'm happy to talk about the effects of private equity in long-term care, but I think you can kind of get what I'm putting down, you know what I'm saying. So I hope that answered your question. Happy to talk about this stuff all day long, but as always, if you have any questions, let me know.
Okay, just found out this afternoon that the nursing home that my dad is in is ending their Medicaid contracts. And he has until September 15th to figure out what to do. And so I've just been down the rabbit hole to try to figure out why would a nursing home end their Medicaid contracts.
So it's because of the big beautiful bill. I'm going to save you the trouble of going through a deep dive. That's why this is happening. Because I don't think people realize that 65% of nursing home residents are covered by Medicaid. So what did y'all think was going to happen when Congress just passed the big beautiful bill and Donald Trump signed it into law, which had nearly $1 trillion worth of Medicaid funding cuts in it? I mean, it's going to shift the burden of cost over to the states, and a lot of states are not going to be able to eat that cost without jacking up taxes or cutting other benefits, so they're going to cut Medicaid funding. And nursing homes have to respond to that. So the way they're going to respond is a couple of ways. One is they're going to just restrict the amount of Medicaid patients they accept into their facilities. Two is that they're just going to boot out already existing Medicaid patients to open up those beds for private pay patients so that they can still make money. Or they're just going to shut down entirely because they can't function without that Medicaid funding. Any of those scenarios is just going to be devastating to the vulnerable patient population that requires skilled nursing facilities for care. Those are elderly patients and disabled patients. And what's going to happen to those patients? You can't just throw them out on the street. A lot of them are just going to have to go back home and live with their families, who are going to have to figure out how to make that work, how to provide the skilled nursing care that they were getting at a nursing facility at home. A lot of patients who are in the hospital, who are ready for discharge, who would normally go to a nursing home, they're just going to be sitting in the hospital till we figure out a way to get them home safely. And that's going to cause a lot of delays in care because it's going to cause backup in the hospital, and patients are going to be waiting in the emergency room, and emergency room waits are going to be longer and longer because the hospital just can't discharge patients because they have nowhere to go. So this is a direct result of the big beautiful bill that Donald Trump campaigned upon that was in Project 2025. And elections have consequences, and despite knowing all of this beforehand, a lot of people still voted for it. A lot of people who have elderly parents in nursing homes. So this is going to impact every single one of us. And I don't know what to tell you, but it's because of the big beautiful bill. So there you have it.
Did you guys see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients. These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down. This is one of the reasons, this is the main reason why I did not want to rely on the U.S. for my income while I'm living abroad. The economy here is bound to crash. When you cut Medicare like that and these places close, a lot of people are going to lose their jobs. The dollar is going to suffer. There is no forethought with these people. They have no idea what is happening.
Name the only NFL team that ends in the letters ES. You have 1 minute, start now.
ES. Not the Bears. Packers. ES.
There's only one.
Raiders. Chargers. A lot of RS.
30 seconds.
Jets. I have to go through the whole. I have to go through the whole NFL.
ES.
ES.
There's only one.
Redskins, Cowboys.
Got 15 seconds, Dad.
Well, the pressure's on. Titans, Falcons.
There's only one.
One of the bird teams, I'm thinking. Ravens,
Last guess.
Falcons, Ravens.
Time.
Welcome back, fam. So here's the breakdown. On one side, we've got a healthcare worker, not a politician, not a corporate executive, a frontline worker, literally spending their own money to buy medicine and supplies for their patients. Why? Because insurance won't cover it, and the patient can't pay for it. And before anyone says, well, maybe they can just pick up an extra shift, these patients can't work either. So they are trapped in a system that says, if you can't make us money, we won't keep you alive. That's not healthcare, that's a business plan. So then we hear from someone who's, let's just say, feeling pretty confident in their health and their ability to work. They say, Medicaid cuts, I'm for it. If you can work, you should work. This is that classic rugged individualism mindset, the belief that only people in visible distress deserve help. And if you are struggling, it must be because you didn't work hard enough. But the second half of that stitch is where the hammer drops. You see, because the next person, and bless them for their patience, lays it out plain. You are one tragedy away from needing Medicaid and Medicare. Not 5 tragedies, not some unthinkable medical mystery. One car accident, one tumor, one heart attack. Suddenly, you are not a taxpayer grumbling about freeloaders. You are the one in the ER filling out Medicaid forms. And spoiler alert, the program you wanted to cut just got smaller thanks to your own votes. So let's talk about this, the mother-in-law story, the harsh reality. You see, this story about the mother-in-law hits me hard. Worked 32 years at the same company, union member, steady career, the so-called right way. Then she gets brain tumors, and like millions of Americans, the second she can't clock in, she loses her health insurance. Think about that. You can give your life to a company, and the second you are too sick to serve them, they dropped you like yesterday's trash. That's not loyalty, that's extraction. Now, the "it won't happen to me" myth. Now, I think the most dangerous belief in America right now is, it won't happen to me. We walk around thinking we are insulated from tragedy because we have a job or a good diet or some savings. But sickness doesn't care about your work ethic. The ER doesn't care about your bootstraps. Medical bills can wipe out decades of stability in a matter of months. And then you are the one hoping the system you spend years dismantling will somehow be there to catch you. You see, one of the most powerful points in this speech was when they said, it's not you paying for Medicaid, it's people like me, the younger generation, paying for it for you. That's the part that gets left out of a political debate. The generational contract, where the working population pays into a system to care for those who can't work, is supposed to be mutual. You help the older generation today, and the younger generation helps you tomorrow. But when you cut the safety net, you are not just hurting them, you are touching the bridge you are going to need to cross later. And it's not just about medical care. When your health fails and your insurance is gone, it cascades. You lose income. You can't keep up with your mortgage. You start selling possessions. You may even end up moving in with your kids if you are lucky enough to have family who can take you in. And if they can't, you are suddenly part of a homeless population you might have once dismissed as lazy. This isn't hypothetical. It's happening every day. You see, I know in America everything gets painted red or blue, left or right, but this healthcare is not just a partisan issue. It's a life expectancy issue. It's about whether people live to see their grandkids grow up, about whether a single accident can erase a lifetime of work. And right now, the system is set up so that if you are not actively making profits for somebody, you are disposable. Now, guys, don't get me wrong. Personal responsibility matters, but it's not a healthcare plan. Telling people to just save more or eat better ignores the fact that medical bankruptcy is the leading cause of bankruptcy in America, and most of those people had insurance. What we are saying when we cut Medicaid and Medicare is, if bad luck hits you, you are on your own. And that's not a civilized society, that's a survival game show. So here's the inevitable truth. At some point in your life, unless you die instantly without warning, you are going to need help. Maybe it's a doctor. Maybe it's a prescription you can't afford. Maybe it's a long recovery where you can't work. And when that day comes, you will wish the system was stronger, not weaker. You will wish people hadn't clapped for Medicaid cuts like it was a touchdown. Now, big thanks again to the original creators and Stitches for bringing this conversation front and center. If you are watching this and you think it doesn't apply to you, I promise you it will. And when it does, you're going to hope the safety net is still there to catch you. Stay safe out there, Echo Room fam, and take care of each other, because clearly the system isn't in a hurry to do it. From Echo Room Vibes, peace out.